everyone, in this video today I'm going to be talking about what happens if pandas and PANS is not treated effectively or if it is left untreated. It is quite sad what happens if people aren't treated, but before I get into that I should probably say how it's usually treated. Now of course I'm not a medical professional so I can't give medical advice. This is just what is usually said in how PANS is treated. Usually it can include antibiotics, anti-inflammatories, IVIG, which is, I think, intravenous immunoglobulin, and plasmapheresis in very severe cases. Now, unfortunately, it can be really difficult sometimes to access these treatments. In the USA, they are doing a lot better than they are here in the UK currently, because in the USA, people with PANS still struggle to access these things. They do. In America in general, I feel that some of the hospitals do just have more of an understanding of PANS, whereas here it's difficult to find someone who really knows how to treat the condition. This is why I believe that advocacy is so important, and it's why I spend so much time trying to raise awareness, and so do so many others in the community. There are countless people in the community, which includes both parents and people with PANS, who pretty much just talk about it again and again and again, because we are trying to get the word out there. It's so important. But yes, what happens first of all if it is treated effectively? I think that's important for me to touch upon first. If it is treated effectively, then people can get their quality of life back. People can be themselves again, because PANS can look like a sudden change. People may be fine 1 minute and the next day they are disabled by their condition. It's absolutely debilitating and they are tormented by the symptoms. So the right treatment can get someone out of this and can give them their quality of life back, which is what everyone deserves. And it can really help people get better, because people can go back to baseline, go back to how they were before it all. People can get better. I'm going to keep saying that it's possible. For example, on the NIH Genetic and Rare Disease Information Centre website, they, not in the same words, but they do explain that PANS can get better. They also explain the possibility of relapse, which can happen, but people can get better. But they also say that if left untreated, it can be permanently debilitating. That's the whole thing. If you don't treat it, then it can just persist, and no one should have to go through that. That's really sad, because whole lives are thrown away. Untreated PANS or ineffectively treated PANS without addressing the underlying trigger infection and without addressing the immune system inflammation, that would lead to someone potentially going years, decades, or even a lifetime with debilitating neurological and psychiatric symptoms. So lives can be pretty much thrown down the drain, because it can be difficult to find a doctor who understands, and no one deserves this. Anyone could be affected by PANS. PANS can occur at any age, and it could be someone you love. And imagine how it would feel to have someone you love have a condition that's treatable. They can get their life back. They can get better. You've seen cases of it in other parts of the world where people have got better. But you see them screaming and crying, begging you to make it stop. But wherever you turn, no one can help you. No one can offer the right treatment. And you realise that without the right treatment, this could be their life. Their lives could be thrown away. They may not be able to function unless they get the right treatment. And no one should have to go through that. It is preventable. And no matter how long someone lives with the condition, I believe it is treatable. But even for decades of searching, sometimes people really struggle to find some help, which is absolutely awful, because it seems that the specialists in the condition are so far and few. And I think doctors, of course, they are always looking for the what's most likely. Therefore, if you come in with a constellation of symptoms that can occur due to PANS, they'll probably diagnose you with Tourette syndrome or OCD or autism or sensory processing disorder or ADHD, maybe bipolar disorder, something like that. But those diagnoses may not explain all of the symptoms that someone experiences. They don't explain why it can be triggered by an infection. They don't explain the relapsing remitting course that people may have, where they might be in remission at one point and they're fine, and they get an infection and suddenly develop an absolute ton of different symptoms, which they may not even had in the previous flare, and it doesn't allow people to access the right treatment. And that's a huge issue, because of course this is the point of the whole video. If someone's misdiagnosed, then they struggle to access the right treatment, then they live a life like that and their whole life is thrown away. And that shouldn't happen. That should never have to happen. Now, of course, with the with the OCD and psychiatric symptoms, other psychiatric symptoms that can occur as part of PANDAS PANS, you're probably thinking, well, why can't someone just go on antidepressants or antipsychotics and be fine? Some people do respond to these medications, and it can be helpful in some cases. But the problem with that is that there are other symptoms as well, such as the developmental regression, the brain fog, where people may be unable to think clearly. They may feel very dazed and, just kind of confused as well. People might have changes in the way they think. They might be very, very, very literal, to the point where nothing really makes sense anymore. People may have dilated pupils, not dilated due to anxiety, just in general dilated pupils. People may have a loss of coordination. The loss of coordination is not something I've heard in many others with PANDAS PANS, but that was just in my case. I was reaching out, couldn't grab stuff. My body did not work. My brain didn't really work. But that's something that I believe there are others out there who've experienced what I've experienced. The handwriting issues, maths issues, the oppositional defiance, personality changes, this enuresis as well, which is the wetting that isn't due to OCD. All of these symptoms may persist because medication can't really target those necessarily. So people can still be struggling, and they're still not themselves because they still can't think clearly. They still can't really function as well as they could, even though maybe the OCD, depressive symptoms, and psychosis are maybe alleviated a little bit. But the problem is that some people in the community do not respond to these medications at all, and in those cases it can be absolutely heart-wrenching, because if you've tried all of the psychiatric medications offered to you, the psychotropic medications, and it's not helping, then where do you turn? And it can be really, really difficult. And as well as this, it isn't just if you're misdiagnosed that you struggle to access treatment. Even if you are diagnosed with PANDAS PANS, which unfortunately is difficult to get a formal diagnosis of the conditions, but if you are diagnosed with it, then some doctors will turn you away because they don't have the resources to be able to help you, and that is, again, really difficult. So I think that raising awareness of what really happens if people don't get the right treatment can allow action to be taken, for people to see this can't go on anymore. People in the community, that's 1 in 200 people, need to have their life back. It can't go on like that. Therapies such as CBT may work for some people in the PANDAS PANS community. CBT in general is usually really effective for OCD and sometimes depression as well. But with PANDAS PANS, it can be so severe that people may not respond to CBT. They just may not see any benefit from it. It may be too difficult for them to resist rituals because their anxiety is so intense. And as well as this, it can be really difficult for some people because some people with PANDAS PANS also have torturous OCD, which is OCD that is not associated with intrusive thoughts and anxiety. Most cases of PANDAS PANS are the anxiety-based OCD, but there is also torturous OCD, where the rituals can be preceded by a physical sensation, and that may not respond to CBT or ERP that much at all, and again, that can lead to people feeling very lost. But by decreasing inflammation in the brain or treating the PANDAS PANS effectively and addressing the immune system, that can be alleviated as well in those cases. But that's only if the torturous OCD is triggered by PANDAS PANS. Torturous OCD itself that isn't related to PANDAS PANS will need a different management strategy, of course. The neurological symptoms can also make it difficult at times to participate in therapy and psychological interventions because people may not be able to think clearly, and they may struggle to remember things that they've been taught, or some things like the loss of coordination or just brain fog, not being yourself, that can really affect your ability to implement the things you've learned in therapy. That's why psychotropic medications and therapies are not enough on their own for PANDAS PANS. People also need the other interventions to have the best quality of life, and not even that, just to function, just to be themselves. That's what's really important. People need themselves back. Unfortunately, without treatment, some people with PANDAS become suicidal or without the effective treatment. And, this because I think the psychiatric symptoms in PANDAS can be so extreme that it often resembles a mix of the most severe psychiatric issues. For example, severe OCD is a symptom, anorexia is a symptom, mood changes that can sometimes resemble bipolar disorder are a symptom, psychosis is a symptom. Therefore, it can look like a mix of the most debilitating and severe and complex mental illnesses mixed into one condition. The problem is, it's difficult to treat. For young kids in the PANDAS community who say they want to die or who have even attempted suicide, and again, countless adults who have been left untreated, and it can result in that. So that is something that's heart-wrenching, and that can be a consequence of ineffectively treated PANDAS. It does break my heart to think of all the people out there who have PANDAS but haven't been given the right treatment and have had years or decades of their life ruined by that choice of not giving them the right treatment, or not even a choice. Sometimes the doctors just don't have the resources, but it can be absolutely heart-wrenching, and I believe more awareness is needed, more understanding is needed, so that people can get the care that they need to have their life back. And I believe that anything is worth trying. I did say that, but if people say, can we try anti-inflammatories, can we try the antibiotics, you never know, it could change their life for the better. Evidence from Stanford University shows that people with PANDAS seem to tolerate lower doses of psychotropic medications. This means that people may react at a lower dose than most people, so most people may experience side effects at, say, this much, whereas PANDAS the threshold would be much lower. It can be really difficult at times, understandably, for doctors to know when to prescribe the antibiotics because, of course, there are the issues around antibiotic resistance and the impact that they have on the gut microbiome, but I believe that with PANDAS, the pros of prescribing antibiotics can outweigh the cons, because sometimes people are on antibiotics for a bit and then they can go off them and they're fine. Some people do need long-term antibiotics, but this is the same for people with rheumatic fever to prevent them from getting Sydenham's chorea, which is an autoimmune condition where triggered by strep, where the basal ganglia is attacked. Sounds like PANDAS, not the same thing, but that the whole way it works is similar to PANDAS. So there have been people on long-term antibiotics before, and PANDAS and PANS are serious conditions, so I believe they do warrant those sort of measures. And if it's enough to stop someone from wanting to kill themselves, then I believe it's worth it. So I think that with that sort of thing, it's the pros do outweigh the cons. It can prevent a life of living with severe OCD, severe depression, psychosis, and complex neurological issues. So I think it really is important. And of course, I think probiotics can be used to address the gut microbiome issue. If anything could help, then why isn't it done? This is editing version of me because I remembered something else I wanted to put in the video, so I'm going to add this into the video that I'm now editing. Two other things that I feel are important to say is that some people with PANDAS/PANS will sort of have symptoms piling on top of each other, adding on, because some people may go into flare and then go into another flare, and if the last one wasn't really managed, it can kind of seem to add up all on each other. And the right treatment could prevent this, and when it's just treated with therapy and psychotropic medications, it's probably not going to really stop that sort of piling up of symptoms. And as well as this, there are also some cases where PANDAS is said to be chronic progressive. That's a smaller number of cases, but I believe that is where it gets worse over time, and treatment in those cases can really help because it can stop the progression, really. And I also want to say that some people do think it's appropriate to treat PANDAS with just psychotropic medications and therapies. But if we look at other sorts of inflammatory or autoimmune brain conditions, such as anti-NMDA receptor encephalitis, you wouldn't just treat the psychiatric symptoms in that with like antipsychotics and stuff, because that form of encephalitis, anti-NMDA receptor encephalitis, can trigger psychosis and personality changes, and mood changes, and those things can also occur in PANDAS PANS, but that's a condition that you wouldn't just treat with psychotropic medications. You need to address the encephalitis, you know, so it's similar in PANDAS PANS. You need to address the inflammation in the brain, the immune system, and whatever triggers it. Some people struggle so much to access the right treatment, as some people don't see how these sorts of treatments can help psychiatric symptoms, but it's the whole autoimmune encephalitis sort of thing, how the immune system can attack the brain, leading to those sort of symptoms. It can be difficult as well, because I think that in some cases of PANDAS PANS, it may be more about post-infectious inflammation, so people may not necessarily have the infection all the time when they have symptoms. That could be the result of having the infection even after the infection's cleared up. Inflammation can still be present in the brain. With this, I think that as well, in some cases, I'm not quite sure, but it could be difficult to detect a strep infection, because I know 2 years after my onset at age 8, I had a blood test for strep and it came back negative, but after 2 years it's not going to pick it up, because there are, well, as far as I know, there are 2 blood tests for strep, the ASO titer and the anti-DNase B test, but I think the anti-DNase B can detect strep in the body for longer, but I still think 2 years is too long. So that's the thing, some people are left too long to be able to even detect an infection, but they still need treatment, they still need the inflammation addressed, and they still need things to support their immune system, and antibiotics can be trialled in those cases as well. It may help, and woo, chicken. Even if antibiotics don't help in some cases, then IVIG, anti-inflammatories, plasmapheresis may work for some people, because everyone's different. But all in all, it's really, really important to not forget the whole immune system, autoimmunity part, and the inflammation and the infection. If you're just treating the symptoms, then you're not going to get the best result, and people may still be left completely dysfunctional.